All right, so for the sake of everybody's time, we'll go ahead and get started. Again, my name is Jeremy Yarrington. I work with the business development team here at Orasti with partnerships with employers like Austin ISD and other various organizations. And so today we're going to be kind of going over this topic of shoulder pain and some different things that you can do to help prevent it. And with me today, I've got Dr. Williams, who's one of your local providers there in the Austin area, and he's going to be going through really kind of the meat of today's presentation, kind of covering some of the more clinical stuff that's going to be much more impactful coming from him than it would be coming from me. But before I hand it off to him, there are just a few things that I want to address, kind of as housekeeping items, I guess you could say. So the first one being that obviously this is a fairly unique time. We're doing all of these things virtually, whereas normally we would be there in person doing it more of a lunch and learn type of setup. But due to the fact that we are online and doing this through a teleconference platform, we do ask that you refrain from sharing any of your personal health information, just so that we can try and stay as HIPAA compliant as we possibly can throughout this presentation. So if you have a question that would kind of divulge some of your personal health information, we do ask that you wait to ask that until after the presentation and do it via email. Everybody that registered today is going to get a follow-up email from Chris Jammer. You'll see his email address here on this first screen. And so all you have to do is simply just reply to that email if you do have any of those more specific type of questions. The second kind of housekeeping item is that upon entry into today's call, everybody was placed on mute. That's just simply to help us avoid any background noise so that the audio is nice and clear for everybody throughout the whole presentation. So for any questions that might come up during the presentation, there is a chat feature in this call. And so once I hand it over to Dr. Williams, I will send a message through that chat so that everybody knows where it is. And so throughout the presentation, go ahead and send in any question that you come up with through that chat. And we will save some time at the end of today's presentation to cover all of those questions. So send them over whenever you think of them throughout our time today. So what we're going to do is kind of go through again just some common shoulder injuries that Orasti sees in our clinics, some different ways that we would prescribe rehab to help with those types of shoulder issues. And then we'll also kind of touch on just Orasti in general at the end, because I do know that there might be a few of you on here today that are not very familiar with Orasti, or maybe you've never even heard of us before at all. So I will kind of talk a little bit more in depth about who we are and what we do towards the end. But just kind of keep in mind throughout this presentation that we are a group of healthcare providers that help musculoskeletal based conditions. So things like shoulders are definitely in our wheelhouse and something that we treat in our clinics on a fairly regular basis. But without further ado, I'm going to go ahead and pass it off to Dr. Williams. He'll kind of walk us through majority of today's presentation, and then we'll wrap it up at the end. So Dr. Williams, go ahead and take it away.
Awesome. Thanks, Jeremy. Thank you guys for joining us today as we talk about some shoulder conditions. So what we're going to do first, we'll kind of overview kind of the main topics of shoulder injuries we're going to talk about. These kind of fall into the main categories, the main headlines of shoulder problems. So again, we'll talk about each one of these in more detail moving forward. But first one is rotator cuff strain. We're going to talk about what a rotator cuff is, what a rotator cuff strain is. We're going to talk about shoulder impingement. That's probably the most common thing we treat here in the office with shoulders. We'll talk about tendonitis. And then we'll also differentiate between tendonitis and bursitis. And then lastly, we'll talk about arthritis, specifically osteoarthritis. That's the most common type of arthritis people get. It's basically just kind of wear and tear that we all get. But those are kind of the main categories of shoulder injuries we're going to cover as we move forward. So the shoulder is a very complex joint. A lot of people just think about the shoulder as being just this ball and socket joint that lives right out here. But in reality, it's a complex of 3 joints. It's this what we call a glenohumeral joint. That's where your humerus fits into the socket. Then also, a lot of people neglect your shoulder blade. Your scapula is also part of the shoulder complex as well. So whenever you move your shoulder around, your shoulder blade and your humerus work together to help create some ranges of motion. And the last joint lives right on top, right about there. It's called your AC joint. Basically where your shoulder blade and your clavicle, your collarbone, meet together. So there's three main joints that comprise your shoulder. That's why we call it a shoulder girdle, in conjunction with all the muscles, bones, tendons, and ligaments, things like that. It's the most mobile joint in your body. It's pretty obvious. You can do a whole lot with it. If you look down below at the ranges of motion, adduction is just bringing your arm kind of across your body, kind of like this, like if you're reaching across to touch your opposite shoulder. Abduction, it'd be like if you were reaching your arm up over your head, sort of like that. Flexion, reaching right in front of you. Extension, reaching right back. Internal rotation would be like reaching behind, like you're trying to touch your shoulder blade. External rotation is if your arm's up like this, you're turning it out. And then 360-degree circumduction is basically that right there. I don't know if you guys can see that very well, but that's a lot of ranges of motion for your shoulder. And you have different muscles or different muscle groups that are responsible for each one of those ranges of motion. So it's pretty clear that the shoulder is a very complex joint with a lot of moving parts. So if you look at this picture right here, over on the left side of your screen that you're looking at, that's the top layer. And then on the right side of your screen is the layer underneath it right through there. When you talk about muscles for your shoulder, you have two categories of muscles. Muscles that are designed to stabilize your shoulder, and then muscles that are designed to move your shoulder. So for example, let's say if I reach out to touch the screen. There's muscles that are holding my shoulder in place, so I'm not all over the place, and muscles that are doing a very specific movement. And all the supporters want to do is support you, and all the movers want to do is move you, and they get really unhappy, and a lot of these problems develop when you start to get their roles reversed. So the main support for your shoulder should be coming from this muscle group called rhomboids. You can see at the bottom on the right, you kind of follow that line up, that goes right in the middle of your back. Basically, it connects your shoulder blade to your spine. So the job of those muscles is basically pull your shoulders down and back into a nice neutral position. That's how we're designed to be supported. When those guys are supporting you well, all the rest of the muscles on this chart can just be responsible for moving you. But equally important, those movers can be moving in the right position. But the problem with these rhomboids is they also help us function straight out to the side. And we don't do much out here compared to the amount of time we spend in front of us with our shoulders kind of rolled forward like this. So what happens is those supporter muscles, those rhomboids, have a really hard time holding us up. So what starts to happen is you start to recruit help from the mover muscles to now become supporters. Most commonly, that muscle group on the top left over there called your trapezius. That's this guy that lives right through here. The only thing this muscle can do to exaggerate is this. The more time we spend on our computers like this or on our phones or whatever, this strap starts to become a stabilizer. What happens is this starts to pull your shoulder kind of up and in that direction. Huge exaggeration. And what happens over time is our shoulders start functioning from here as opposed to its neutral position. And that's kind of the genesis of a lot of these shoulder conditions that we're about to cover. So kind of the gist of it is the foundation of your house, the rhomboids, aren't doing their job. So now you're kind of moving from a very shaky surface. So the first thing we'll talk about is called a rotator cuff strain. Your rotator cuff is made up of 4 muscles that literally encapsulate or put a cuff around your shoulder. One of their jobs is to kind of hold things in place, to give it a very kind of stable structure, basically, for lack of a better word. But these 4 muscles all have individual jobs. That first muscle on top over there, it's called the supraspinatus. Its job is to do what's called abduction, which is basically just bringing your arm up to the side, kind of over your head. Infraspinatus, its job is to externally rotate your shoulder. So you kind of see that direction like that. It's a little buddy right down below it. It's called teres minor. It also externally rotates you. And then the next picture down below is actually your shoulder if we're looking at you from the front. We're looking at you from this direction, and you can imagine your rib cage being right over where that little cursor is floating right there. So that muscle is called subscapularis. It does the opposite of what infraspinatus and teres minor do. This muscle does internal rotation. So if I'm here, this muscle is going to turn me in that direction, or it's going to help me kind of reach behind my back to scratch my back. Those are your 4 rotator cuff muscles. They all have individual jobs, but then they work congruently together to form a cuff to create some stability for your shoulder. So typically when you hear about rotator cuff strains, which we'll talk about in a second, it's usually one of these 4 muscles as opposed to the whole thing. almost like 4 tires of your car. A lot of times if you have a blowout, you have a flat tire, you have a one flat tire, and you don't have all 4 at the same time. It's typically how rotator cuff injuries will work. So some signs and symptoms of rotator cuff strain: pain is at rest. You're just sitting around. It's a lot of times it's dull, kind of achy, it's naggy, it just won't go away. Increased pain at night. Specifically if you sleep on your shoulder, even if you sleep on the non-painful shoulder, if you're hugging your pillow like this, that's going to put some strain on that shoulder right there. Obviously, pain or weakness with any lifting, any range of motion at all. Sometimes some cracking or clicking, especially when there's pain involved. If your shoulder is just kind of popping and creaking while you're moving, that's typically not indicative of strain. But if you can link it with some of these other symptoms, meaning it hurts and it's popping, that typically means a strain's involved. Causes for rotator cuff, one is acute. You do something and boom, there's a problem. We see that people doing some overhead lifting or doing some pressing, or maybe you're doing too much gardening, you lift something and all of a sudden that's immediate high pain. The second one, probably the most common one, is poor posture. That's kind of what we alluded to earlier. The stabilizers, the rhomboids, can't put you in a neutral position as you roll forward and then go about trying to do something. That's what creates some problems and some strain on one of these 4 rotator cuff muscles. And then overuse, repetitive tasks, weightlifting, sports. Definitely if you have kiddos who are doing any overhead sports, volleyball, serving overhead, certainly pitching, all those movements where it's just a little bit of abnormal biomechanics just over and over and over and over and over, and eventually creates a problem. So that's rotator cuff strain. If you ever get that diagnosis from somebody, it'd be really important to ask them which one of those 4 rotator cuff muscles is involved. That kind of helps dictate care, that helps dictate your range of motion. Almost like if you have a flat tire, you need to know which one of your 4 tires is flat, so you can address it. The next one, like I said before, is kind of the most common shoulder problem that we see. It's called shoulder impingement. It's when basically a structure, whether it's a tendon or a bursa sac, which we'll talk about, becomes impinged or compressed between 2 bones. So if you look at this picture kind of on the right-hand side of the screen there, that's a picture, again, of your, that would be your right shoulder for looking at you from the front. So you can see where his cursor is right there. That's your humerus, that's your arm bone, right? And it fits into the socket or the ball and socket there called the acromion. And that's where all of the ranges of motion happen with your shoulder. And then right above that, that other bone on top is your AC joint. So if you feel you've got a little flat surface right there, you kind of feel the hard kind of bony ridge. Most of the tendons that go into your shoulder, whether it's your supraspinatus for your rotator cuff, your bicep, or your tricep, or whatever it might be, go underneath this bony ridge into your shoulder to help it move. Part of the job of that bony ridge is to provide a little shelter. That way, if something hits you on your shoulder, you're not right on the tendon, you have a little bit of a roof there. But if you look at that supraspinatus tendon, remember that's one of your rotator cuff muscles that helps you look to the side. That tendon goes right in between your humerus and that acromion. And so what happens is when the muscles between your shoulder blades, those rhomboids, do their job, they pull your humerus down in what we call a closed packed position. So basically it's happy place. So there's space in between that acromion and that humerus. And now as you lift your arm, there's room for that tendon. But when those stabilizers have a hard time stabilizing you and this upper trap starts to do is to kind of compensate, it pulls your humerus up like this. So now that tendon is the monkey in the middle and it starts to get impinged between those 2 bones. So anytime you move, that tendon's getting compressed, it becomes inflamed, it becomes irritated. That's what we call rotator cuff impingement. You can see down below it says tightness in the chest muscles also pull you forward. A lot of times it happens, especially now we're working from home. Things just get pulled forward because we spend so much time living right here these days. So it just pulls that shoulder and puts it in a compromised position. So that's impingement. That's basically a tendon getting compressed between 2 bones. And that's more of a symptom of those scapular stabilizers not really doing their job. So here's some signs and symptoms of impingement. So sharp pain, either on the front of your shoulder here or second commonly there. Pain with throwing, pain with any overhead movements, even if it's just grabbing a glass out of a cabinet or washing your hair, things like that. And pain in the back of the shoulder, back through there as well. Again, it goes back to posture. Those stabilizers not doing their jobs. Poor movement patterns, kind of the same thing, and then certainly overuse, just repetitive movements over and over and over without really giving that shoulder much break. Grab a sip of water. That kind of brings up something that's probably worth mentioning before we go to the next topic is something that we call the inflammatory condition of an impingement. What that means is you can imagine that tendon has been getting impinged between those two bones, right? As that tendon gets impinged, it starts to swell. And the bigger that tendon is, the more likely you are to repetitively impinge it. So that's why these repetitive tasks become problematic, because you just aggravate it, and that tendon becomes inflamed, it becomes irritated. So ice is a great first line intervention for your shoulder at home. So if you start to notice a shoulder symptom, throw some ice on that guy, because it's going to help reduce that swelling to give that tendon more room to function. So be less likely to impinge it. So bursitis. Bursitis is a very common diagnosis. You can see those little blue dots all over the place on this. Those are bursa sacs. What bursa sacs are, a good way to think about these guys is basically like a water balloon. The job of tendons, which we'll talk about in a minute, is to connect a muscle to a bone. But the problem is that these big, powerful tendons connect right next to a bone. So if those muscles contract without any cushion there, it creates a problem. These bursa sacs act like a little pillow or a little cushion to provide a soft landing spot for those tendons. And that creates some comfort as you move these big, powerful muscle groups through their ranges of motion. But the problem is as you start to aggravate that bursa sac over and over through either bad biomechanics or through just repetitive overuse, that bursa sac becomes inflamed. And all the itis is inflammation. So it's inflammation of the little water balloon or inflammation of the bursa sac. That's a very common diagnosis as well. But again, it's a very misleading diagnosis, because you don't have a bursa problem. You have a symptom of inflammation in your shoulder because your shoulder's not moving the way it should. There's 6 bursa sacs located around your shoulder. It doesn't really matter which one becomes irritated, because they all basically become irritated for the same kind of biomechanical reason of shoulders functioning from an abnormal position. Again, ice works great for that. So this is kind of what I was talking about before in terms of posture. You can see this guy, looks like he's having a rough day. Shoulders all rolled forward. Those muscles between your shoulder blades aren't able to pull him back into a nice neutral position. So then if he spends his day living in this position, then as soon as he gets up and let's say goes to grab a glass of water out of the cabinet, he's going to function from that position he's been in all day, because that's what he's trained his body to do. And that's what creates these bursitis conditions or these impingement conditions. Typically, pain's worse in the morning. Typically with bursitis, things feel better the more you move. You kind of loosen things up. It starts to create less stress on that tendon. Things are kind of almost like putting WD-40 in your shoulder. Things are starting to move a little bit better, kind of warmed up a little bit. You still have that constant sort of dull achiness. You may even see some swelling. Certainly if you touch your shoulder, you'll feel, it's really tender. That's because you're right on that inflamed water balloon or that inflamed bursa sac. Certainly overhead movements, again, create a lot of issues with these bursitis conditions. So typically, if you're just having this sort of dull achiness, that kind of falls into the bursitis or the tendonitis, which we'll talk about, condition. If you're having very positional pain, meaning it hurts when I do this specific movement and I can touch it right there, that typically is more indicative of either an impingement or a strain type of injury. So tendonitis. The job of a tendon is to connect a muscle to a bone. That's its main job. It's very dense, thick connective tissue. And then tendonitis happens when that tendon becomes inflamed. Most commonly to your supraspinatus. Again, that's this guy right out to the side. It helps us function out this way. Also to your bicep. A lot of people have pain either one of these two places on the front of your shoulder right there. And why does this happen? Typically, tendonitis is what we call repetitive micro traumas, meaning like you do something like the swimmer, just stroke after stroke after stroke as through his swim training, starts to put a little bit of an issue. Almost like, let's say if I just start tapping on my desk, right here a little bit, if I keep tapping on my desk, eventually I'm going to wear a hole in the desk or get a crack in it. That's how tendons work. Little bitty micro traumas over and over and over, and eventually you've created tendonitis. Typically, again, repetitive overuse, repetitive misuse, posture. Again, I think we've talked about this over and over and over in terms of the effect of posture on shoulder conditions. Signs and symptoms, typically dull, achy, difficult to pinpoint. So it kind of hurts somewhere in the front of my shoulder. I'm not exactly sure where. A lot of times it happens deep down inside, but my shoulder really aches deep down inside. I can't really localize it. Typically, that's a tendonitis condition. Sometimes it radiates in your upper arm, specifically down your bicep. Pain is worse at night. Obviously, tenderness, stiffness, swelling. Swelling is very rare for shoulder. If your shoulder's swollen, go get it checked out immediately. Something's wrong in there. Again, posture, the main cause of that, and repetitive issues. So again, like we just talked about, to be able to differentiate between impingement and strains, very focal itises, whether it's bursitis or tendonitis, tends to be more kind of diffuse and kind of global across your shoulder through there. So next one to talk about is osteoarthritis. Arthritis is a word that gets thrown around quite a bit. There's lots of different types of arthritis. There's obviously osteoarthritis, there's rheumatoid arthritis, there's tons of different types of arthritis. So if a doctor tells you you have arthritis, a very good question back to them is, what kind of arthritis do I have? Because that's going to dictate how you go about treating them. When we talk about osteoarthritis, which is far and away the most common type of arthritis, there's two main causes for arthritis, osteoarthritis. First is genetics. So we're all set on sort of a bell curve genetically over how prone we are to arthritis. Most of us are right in the middle. Some people genetically are more predisposed to more arthritic conditions, some people less. Most of us are right in the middle of that bell curve. And then how you treat your shoulder can skew you up or down on that bell curve. So you genetically can be, have this really high predisposition for arthritic shoulders, but if you treat your shoulder really, really well and help it move well, you're going to skew yourself back down that bell curve toward a less vulnerable shoulder. Opposite of that is true also. You can have the best genetics in the world, but if you're a bull rider, then you're probably going to have an arthritic shoulder. So it's if your parents have arthritis, your grandparents, that's not necessarily a nail in the coffin in terms of you're doomed for problems. If you can keep your shoulder moving well, there's a lot you can do to kind of fight against that. So arthritis, the word arthritis means is joint inflammation. It's just basically wear and tear, overuse, repetitive use. Signs and symptoms, pain, stiffness, discomfort, typically globally. Worse in the mornings, worse after or during activity. Can't move as well, just tender all over, achy. Again, like we talked about, the causes, wear and tear, repetitive kind of previous injuries, family history, certainly age. The only reason age is really a factor there is because if you're 60, you have 60 years of use on your shoulder, and if you're 16, you only have 16 years of use. So it's that timeline that kind of pushes you toward that direction. So a lot of people get that arthritic condition and think they're doomed with it. That's not necessarily true. A lot of times there's a lot you can do to get your shoulder moving really, really well, and more times than not, that adds a lot more vitality to your shoulder. So some prevention strategies, what can you do? We'll go through some exercises. And like he said earlier, Chris will send you guys an email at the end of this or sometime later today that's gonna have these exercises in them. So don't feel like you have to grasp it all right now. But when we talk about prevention strategies, we kind of break them down into three categories. First is mobility. We use things like lacrosse balls and foam rollers, and that's just getting your shoulder moving well, getting the cobwebs out of there, getting the stiffness out of there, getting things moving better. And then stretching. Stretching works really, really well for shoulders if we spend time in this prolonged static position where some of these structures are tight all day. We need to stretch them back out before we need to go move them. And also strengthening. We want to make sure that all our shoulder muscles are strong, but equally important, we want to make sure that they're working well together. Kind of back to that tire analogy, you want all four of your car tires aired up the same, aligned well, balanced well, then your car moves well, shoulders work the same way. It's really important to work on strengthening the things globally. So again, back to posture, you can see that big blue arrow in the back. That's where those scapular stabilizers live. If those rhomboids were doing their job, they'd pull this dude up into a nice neutral position. That's how things should be supported. But as we spend time like this, you can see that those muscles in the back get lengthened. When they get lengthened, they get really, really weak. They have a hard time doing their job. But the opposite of that's true in the front, where you see those white arrows. These pec muscles, these big, powerful deltoid muscles, all these guys, we keep them in a shortened position all day. They're pulling you this way. So it's the tug of war between these guys being so tight and these back muscles being weak. It turns into something called upper cross syndrome, which is basically what causes your shoulder to be functioning from, again, this position as opposed to a nice, happy position that puts, that optimizes the mechanics of your shoulder through there. So this first one is something called foam rolling. Foam rollers are becoming more and more popular. A lot of you guys may have heard of foam rollers before. When we talk about thoracic foam rolling, your spine is broken down into 3 parts. What's called a cervical spine, that's your neck. Then your thoracic spine is from the base of your neck right about to the maybe 2/3 of the way, 3/4 of the way down your back. That's your thoracic spine. And then your lumbar spine makes up your lower back. As we spend time, kind of like in that last slide where that guy's all hunched forward, that part of your spine, that thoracic part of your back can't move very well. It gets kind of locked down. So what the foam roller does is help us kind of loosen up that part of your back. When you go to grab something overhead, your back can move as well, as opposed to trying to fight that part of your spine that puts a lot of stress onto that shoulder. Foam rolling works really, really well to loosen up that part of your back. The next one is lacrosse ball. She's lacrosse balling right on her pec, kind of right through there. Over in the front of your shoulder works well too. Lacrosse balling even on this upper trap can be very effective. We usually recommend using lacrosse balls because they're very solid. If you guys haven't used one, get one on Amazon. They're really solid rubber balls. If you're using like a racket ball or a tennis ball or something like that at home, a lot of times it's too soft and you wind up sinking into it as opposed to it pushing into you. The job of this is just to break up some of that tight tissue, break up some of that connective tissue or some of those cobwebs on your shoulder that happen because we sit too much. Lacrosse balls are a great tool. And you can see now that she's doing it on her back. It's kind of hard to see on this picture, but she's just literally up against a wall, bringing her arm across, just kind of rolling around through there, looking for problem spots, looking for those muscle knots to start to kind of work out. If you can work on those muscle knots, that whole shoulder complex will move a whole lot easier. And then chest stretch, pretty straightforward. Again, like that guy we saw a little bit ago, he was just leaning forward. Those chest muscles get tight. All she has is just her arm out on the wall. The doorway works well. You can get the doorway and kind of just stretch out this way. You can feel a really good stretch across your pec there. Typically, we like to hold these for at least 60 seconds, sometimes even longer. 60 seconds is a long, stinking time. So I'd strongly encourage you to, if you're doing the stretch, to look at your clock, set a timer on your phone, do something like that, because 60 seconds is going to feel about like 15 minutes if you really do it right. But I encourage you to give time to stretch like that. What happens when you start to stretch, all you're doing is lengthening muscles. And what happens is that your body doesn't know when that stretch is going to stop. And so what happens is that if you overstretch a muscle, you tear it. So your body has a protective mechanism to kind of guard against that stretch for a while. And then it'll finally say, all right, everything's cool. I can relax. Then you get a nice, let's say, kind of gentle stretch through there. If you're just holding a stretch, 10 seconds, you're still in that body's kind of protective mode, and you're really not getting much of a benefit. So at least 60, sometimes even 90 seconds for a stretch. And that applies to any muscle you're stretching, not just back muscles. And seated thoracic rotation, all she's doing is sitting up nice and straight. That's the first key when you do this. Make sure you're not kind of hunched over like we normally would be. Sit up really nice and straight. Just very gently twist. Very, very gently grab your chair just with a little bit of resistance. By all means, don't pull very hard. Don't force anything. Don't try to get your back to pop. You're just looking for a nice, gentle stretch. Obviously, you want to do that both sides. Again, 60 seconds or so, a nice, good pull really helps open up that part of your back and get those rhomboids or those stabilizer muscles working well. Arm circles. Arm circles can be great. They can also be problematic. The issue with arm circles is, where are your arms? So if I can move this just a little bit. So when she's doing these, you can kind of tell she has her shoulders down and back. She's at a nice neutral position. If she starts with her shoulders up like here and tries to start doing arm circles, that's going to create some of those impingement problems like we talked about. It'll be important to start by bringing your shoulder blades down and back into a nice neutral position, and then start the arm circles from there. Again, if you can do it from a great spot, it's going to be a great exercise for you. I usually like to do about 10 going backwards and maybe 10 going the opposite direction. Again, but the focus being on what's happening between your shoulder blades while you go through that range of motion. These are called Brugers. You can even do these without a band. So let me take you guys for a ride just a second. So what you're doing basically, keeping your arms in nice and tight again, bring the shoulder blades down and back, basically just rotating out just like that. If you have a band or something, that's good to use too. Just nice and easy movements, keeping your elbows in relatively tight, just like that. But the trick for that one, like any of these, is paying attention to what's happening between your shoulder blades. If your shoulder blades aren't locked and loaded into a down and back position, then this can be a problematic exercise for you as well. One more exercise I'll add that's not on this, but this is one that works fantastically for my patients, is I want you to think about trying to put your left shoulder blade in your right back pocket, and think about trying to put your right shoulder blade in your left back pocket. So think about trying to draw your shoulder blades down and back. That visual seems to work really, really well for folks. It's something called scapular control. Basically, how well can you control those stabilizers, those rhomboids, and keep them engaged? I usually tell folks every hour, just practice a few of those. While you're working, just practice drawing your shoulder blades down and back. If you practice drawing them down, you'll disengage the strap. So a lot of times, if you practice bringing your shoulders back, it's really easy to bring them back and up. But if you can bring them back and down, it really starts to engage those muscles and get you really good at using those muscles the right way. Cool, so
Awesome.
turn back over to Jeremy.
Thank you, Dr. Williams, for kind of going through that. I'm going to ask you one of the questions that came through on the chat real quick before I move on, because it does relate to the exercises and stretching. Can stretching exaggerate any of the conditions that you mentioned before? And then I guess a second part to that question would be, if I'm doing one of those exercises and it's causing like pain, then what is the recommendation at that point?
That's a great question. Stretching should not be painful under any condition. Obviously, you should feel a good pull from a stretch. You should feel kind of a normal stretch. But if there's any pain involved, by all means, stop. So that means you're putting abnormal stress on a structure that's compromised. And that's a great time to get that checked out by us or by somebody, because that means there's a problem there. Right? Even if you don't have symptoms with other movements, there's still an issue there. And so the issue is, we can help you pinpoint where that problem is before it creates an issue. So again, stretching shouldn't be painful. If it is, that means there's a problem with that tissue that's involved. Or it could be that you're stretching in a goofy way. If you're stretching, let's say that doorway stretch, for example, like if you put your left shoulder blade in your right back pocket, put your right shoulder blade in your left back pocket, and then stretch out in the doorway like that, that should be nice and easy. But if you're all leaning into the doorway, kind of stretching like that, and you feel some strain on your shoulder, that's because of a technique issue with a stretch, more so than just a shoulder issue. But I'd encourage you, if you're having pain either way, just stop that stretch. There's a lot of different ways to stretch a muscle. So if it's painful, by all means, look for a different alternative.
Awesome. Thank you for answering that real quick. So to kind of close out today, we're going to go over a few more slides here, talking a little bit more in depth about Rosti and kind of what we do and what it means for all of you. But like I mentioned earlier, we are a group of healthcare providers that focus on the treatment of musculoskeletal conditions. So a lot of like what Dr. Williams just talked through with the shoulder. Something that I will mention, because there were a lot of things that can be wrong with the shoulder, like he talked about, is that Rosti really prides itself on how thorough of an evaluation and exam we do with each of our patients when they walk through our doors. So I highly encourage anybody that's dealing with any type of musculoskeletal condition to utilize this benefit that you have, because during the first about 15 minutes of your appointment at Rosti, our provider is going to do nothing but do an evaluation and exam to fully determine exactly what it is that's going on and give you a very accurate diagnosis. Because if we don't do that and we don't get that accurate diagnosis, it doesn't really tell us how to treat the condition that you've come to us with. So we have, in order to be able to effectively treat these conditions as quickly as we do, that very thorough exam and evaluation is super important to pinpoint exactly what's going on. For those of you that have maybe never been to us before, or never heard of us before, this slide here is just highlighting some patient-reported outcomes that we've gathered throughout the years of being in practices. These numbers are all being given by previous patients that we've had. So these are not numbers that Rosti thought just sounded good, so we're just going to throw them up on a slide. I'm not going to go through all of these, but there are a couple I do want to point out that because they do really kind of set us apart from other healthcare options that you might have. And the first one is this 3.2 visit average. So most of our patients, when they go to Rosti, they see us for about 3 to 4 visits, and then they're done with us and they're back on their way. So we really pride ourselves on not wasting your time as a patient and either A, fixing you very quickly in that 3 to 4 visit average, or B, identifying if it's something that we can't help with very quickly and then getting you where you need to be. If we are not seeing the progress that we expect in your treatment, that tells us that what we're doing is might not be the most effective treatment for you, and we need to get you elsewhere. And so we really do pride ourselves on making sure that every visit that you have at Rosti is as impactful as it can possibly be. We have helped prevent over 15,000 physician-recommended surgeries. So I always tell people, if you've been advised to have any type of musculoskeletal surgery, go to Rosti for that second opinion. Let us do that very thorough evaluation and exam with you. And then the worst case scenario is that we do all that with you, and then we tell you, yes, surgery might be your only option. But then that would fall under what we call our worry-free evaluation. And basically what that means is that if we don't perform treatment on you, we don't expect anything out of your pocket in return. And so if you come to us with that surgical recommendation and we tell you there's nothing we can do for it and that you need to have that surgery done, then you're not going to pay us anything for that visit. But best case scenario is that we tell you that we think X, Y, or Z is actually going on. We treat that, and then you end up not needing to have that surgery that you thought you needed to have in the first place. And we do have an 88% resolution rate. So we obviously can't claim we fix every patient that walks through our door, but to have almost 9 out of 10 of our patients tell us that we fully resolved their condition is incredibly high for the musculoskeletal world in general. And so this is a very effective solution and treatment for those types of conditions. Today, we obviously talked just about the shoulder and some of the different things that can come from that. But at Rosti, we are not just specialists in the shoulder. We do see everything in our offices from neck pain and headaches down to plantar fasciitis in the bottom of your feet, and then pretty much anything in between. And this can also be both acute and chronic conditions. So it could be something that happened 2 days ago while you were outside, or it could be something you've been dealing with for the last 15 plus years. So the door really is pretty wide open for any of these types of conditions to utilize your Rosti benefits. And then lastly, kind of what does this mean for you guys? This is always one of the most important questions that we get asked. And so the good news is that Rosti visits are an in-network benefit for everybody that's on the Aetna health plan. And the nicest part about the benefit is that you don't need a referral. So if you are dealing with any of these types of conditions, you can contact Rosti directly to get scheduled for that appointment. You can see on here, there's 2 different ways that you can do that. You can either go to our website at rosti.com, or you can call this 800 number. That's just our corporate office in San Antonio, and they're the ones who handle the scheduling and the billing and the insurance for every single one of our clinics. So no matter where you want to go, that's the number that you call. And our website also has location listings on there for you. So if you want to know which practice is the closest to your house or closest to wherever you want to be, all of that information is on our website. And then Dr. Williams' contact information is on here, and all of this will be in that follow-up email. So if you have one of those more detailed questions or anything like that, please feel free to reach out to him. I know he'd be more than happy to help answer that for you outside of this webinar. So take advantage of that contact information while you have it. And then the last thing that I'll touch on real quick is, obviously it's no secret, we're all in this COVID pandemic and everybody's been dealing with that, either working remotely or still having to go to work physically, whatever the case might be. But we do want to stress to everybody that all of our clinics are still open. We are still treating patients in our offices, and we have implemented a number of new protocols to make it as safe an environment for you as the patient, but also for our treatment teams. So when you call to schedule an appointment, there's some additional questions that you're having to answer to essentially weed out any potential COVID contacts that may be there. And then also when you arrive for your appointment, we're doing things like the temperature checks, we're wearing masks and all that stuff to, again, ensure ourselves that we're keeping the environment as safe as possible for you as the patient, because our patients and our staff always and will always remain our top priority. So we are doing everything we can to combat that. So what I'll do real quick is ask Dr. Williams a couple more questions that came through that chat feature. If you have any that you'd like to submit and you haven't yet, go ahead and take this time to send those in real quick. But Dr. Williams, the first one that kind of came through is kind of going back to the surgical idea, how I mentioned, you know, we really want to try and make sure people seek that second opinion. When, in what situations would surgery be a viable option? Because this individual has been told by many people to avoid surgery at all costs. So I guess kind of what would be an appropriate scenario for one?
That's a good question. And the thing I tell people all the time is just because something's operable doesn't necessarily mean you need to operate. So a lot of it depends on what your goal and what your lifestyle is like. You know, there's a lot of people that are walking around with some rotator cuff tears or some other tears on their shoulder, but they're not trying to be a professional athlete. So that tear doesn't really impact their life. Even though they see, hey, it's on an MRI, yes, we can operate on this, but is it really going to impact their day-to-day life or their what they like to do, their lifestyle? If it's not really going to have that much of an impact, then a lot of times, if you can get your shoulder biomechanics moving well, then all of a sudden in that shoulder, that tear is not as big of a factor. A lot of times those tears, those operable things become bigger than they need to be because your shoulder is not working well because of a postural issue or because of a weakness issue or because of something that's very fixable, you know, is in the way. So a lot of times we'll tell people, all right, let's fix the fixable things first. Let's correct your shoulder mechanics. And then we can see is this operable thing still really that big of a deal? Because a lot of times those biomechanical issues kind of muddy the water and muddy the prognosis. And you know, if surgery is on the table for you as an option, I would get 2, 3, 4 opinions. Once you have surgery, you can't go back. So I'd rather have multiple people telling me, yes, this is what you need to do. And all right, I see this impact my life because it's affecting.
Uh-oh, looks like we may have lost connection there with Dr. Williams. So basically, I mean, again, kind of to reiterate, we obviously don't want our patients to jump to surgery if that's the only option that they've been given. So definitely seek those opinions, and hopefully at Rosti, we can also help provide one of those opinions for you also. Oh, are you back, Dr. Williams?
Yeah, no, I lost you, sorry.
Yeah, no, it's okay.
From my end.
Yeah, no problem. There was one more question that came through real quick though.
Yeah.
So basically, would shooting pain that starts behind the shoulder and goes across the bicep, would that be a sign of impingement or tendonitis?
It's hard to diagnose that over, you know, obviously over telehealth. So I wouldn't give you a diagnosis, but it definitely, you know, it could be either or, quite honestly. It definitely indicates some sort of inflammatory condition in there. Typically, when it's very pinpoint like that, typically it's an impingement issue. But where I would get started on is ice. I start calming that thing down because either way, ice will be impactful for you. And then the only real way to be able to accurately diagnose that would be to come take a look at it, quite honestly.
Yeah. No, thank you for at least giving that insight to it. But again, if anybody has any other questions, please feel free to respond to that email that you will receive later today. If you're like me, you know, you might not be thinking of any right now, but as soon as you hang up, you're going to have 5 that come to mind. So please feel free to respond to that email. We'll get you answers the best that we can. But we really appreciate everybody taking their time out of today to listen to us. We hope that this was a beneficial presentation, that everybody was able to take something away from it. And if you ever need us, please, by all means, do not hesitate to reach out and contact us. But we hope all of you have a great rest of your week. Continue to stay safe and healthy out there. And we hope to see you all in our offices if it's needed. If not, we hope everybody stays healthy and has a good rest of your week. So thank you again, everybody.